Hello everyone and welcome to Advanced Exercise Physiology, Exercise Physiology for Sport. I am Professor Mark Baines with Concordia University, and today we're going to be talking about environment and ergogenic aids with exercise, as well as a few concepts from past weeks in tying together our course. But for anyone else watching, there should be some valuable information here, not just in regard to the environment and ergogenic aids, but some other concepts as well as they relate to training and designing of programs. With that said, starting first right off the bat, referring to some important points. Generally speaking, when it relates to duration and intensity, when you talk about engaging in very short burst activity with near maximal output, which is if you're going to get near maximal or maximal output, it's got to be very short burst activity. We're talking about anaerobic power, which is misspelled there, A-N-A-E-R-O-B-I-C. Referring to speed work, agility work, explosive power work, generally speaking, referring to it maximally in the 1 to 5 second range, but pretty darn close to maximal in the 1 to 10 second range. You go 11 seconds, not that you're not going to be powerful, but that's not really generally recognized as being max. So every second you go past that point, you're losing a little bit of your max, even though it's not wrong to do so. That said, maximal strength, while it can also be in that same time frame of 1 to 10 seconds or so, a very short time frame, it's also more likely to go up towards like 30-40 seconds where you can still produce near maximal strength, near maximal force output at 85-90% max force output up to 30-40 seconds, give or take. Okay, and then comes into play as you progress farther and farther in duration. Your intensity as far as actual force output is going to be dropping. That's when we start seeing things like high intensity interval type training. And there's some crossover in there in terms of time frame relative to maximal strength. High intensity interval training, some people talk about it being as early as 10 seconds of work, where you can do that. You're kind of bordering on the aerobic power type work too, duration wise. If you're really trying to improve glycolytic properties, really trying to improve your capacity to handle longer duration, higher output for longer durations, for purposes of engaging type 2A fibers and predominantly, and engaging in higher levels of force output without necessarily being power. Honestly, it seems like 20-30 seconds seems to be one of your ideal outputs for doing so, but generally speaking, we think of high intensity intervals as being 20 seconds to about 60 seconds, and glycolytic intervals as a whole of being 20 to 120 seconds. Within that general time frame, hypertrophy is kind of in there as well. It's glycolytic primarily, and primarily type 2A muscle fibers we're talking about. And the reason why hypertrophy is about 40-75 seconds is that even though if you go for very short burst activity, you're going to get some hypertrophy of your type 2X fibers theoretically over time, as well as if you go endurance focused, you're going to get more of a type 1 muscle fibers hypertrophied over time. The predominant amount of size you're going to be getting, if the goal is mass building, type 2A fibers are your go-to, so to speak, because you have more of those than type 2X, and you're going to get far more size increase than you are with a type 1. So that's why that's that general time frame for hypertrophy is for maximizing it in that 40-75 second time frame. And of course, that's all glycolytic. As you engage more towards type 2 minutes, 3 minutes, and beyond, you get more and more towards aerobic endurance. And more specifically, as you engage past about 8 or 9 minutes, you're getting it pretty much, you've lost almost entirely, not entirely, your ATP, CP energy system utilization and glycolysis as well, almost entirely, almost near 100%. You can't be 100% because there's always some level of involvement. But that said, that's when you become pretty much wholly aerobic, so to speak, and that's where we see our maximal oxygen capacity, or aerobic capacity, referred to as VO2 max. So work that you can handle for 10 to 12 minutes, that's your VO2 max. Understanding that force output wise, you're now down to about 60-65%, maybe in some rare instances 70% max force output, but that's going to be really hard to see that very often. You look at 60-65% max force output at your 10 to 12 minute time frame, which is your VO2 max, and you start going farther than that, well, lactate threshold becomes more and more important about 15 minutes and beyond. However, critical power is actually a rate slightly higher than lactate threshold. Lactate threshold, really you're talking about work, if you're just below or just at lactate threshold, it's kind of theoretically work you can just keep doing almost indefinitely. It's not that high of an intensity. As we've learned, it's essentially 50 to 90% of your VO2 max. So if your VO2 max force output rate is about 60-65% of your maximal force output, and your lactate threshold is 50 to 90% of your VO2 max, you're looking at, honestly, being about 25 to about 30% to about 55% maximal force output at lactate threshold. So lactate threshold type work is not high intensity work. You can do high intensity intervals and you can have some effect upon VO2 max and lactate threshold. That is absolutely true. But if you're trying to maximize, and your textbook can make it a little bit confusing sounding, because they're not wrong when they say the high intensity interval training can improve VO2 max and lactate threshold. That's absolutely true. And you're trying to engage higher intensity activity for purposes of increasing capacity to handle higher loads or for higher efforts for sports or for conditioning that requires it. And a lot of sports do. It makes perfect sense to do high intensity intervals training because of that, when the person's ready to do so. But if they want to maximize the benefit from high intensity interval training and similar type training, they have to first establish a baseline reasonable level of lactate threshold, your capacity to handle work for lengthy, forever periods essentially. And critical power is your 30 to 60 minute time of maximization of whatever your force output you can handle. So if you want to think about it, slightly higher than lactate threshold effort or force output wise is critical power. And then of course above that is going to be VO2 max. To hopefully clarify a little more for you what we're talking about with lactate threshold and VO2 max. I think a lot of people tend to think of lactate threshold as being something that's always high intensity, when in fact, by nature, it is inherently lower force output, okay? And that said, running economy, when you want to talk about improving your running economy, anything that you do that increases your movement skill or increases your levels of strength, whether that relate to endurance strength, your explosive strength, or your maximal strength, any of those kinds of levels of strength, as if it relates to the specific activity in terms of your motor control, your movement skill related activities, it should theoretically improve your running economy. Now, we have to be careful of is just because you extend your knee when you're running doesn't mean that every single thing you do to work on knee extension is going to automatically improve your running economy. It's a little more significant than that, and to see any real change, it's going to be a lot more significant toward the activity we're looking to improve. And when it comes to running, we got to be clear about the specific joint actions we need, and we got to be clear about then the specific joint actions that we incorporate when we strength train if we want to maximize running economy and overall exercise efficiency. Okay. And ultimately, the goal is to obviously have, with less effort, achieve higher levels of work output and be able to go for longer periods. It doesn't mean we actually always pursue less effort, but theoretically, that is always the goal we're looking for. The person to be able to do more with less, right? That's not an unusual thing or a request that's not reasonable or wanting. Children, we talk about epiphyseal plate or growth slippage. We're talking about something that would take tremendous blunt force impact to create such a challenge or problem. It would be highly unlikely it's going to happen unless someone falls out of a tree, as we said in the past, or really gets hit hard at an awkward angle to specifically break the humeral head plate or the femur head plate. Highly unlikely to happen. If it did, surgery is going to be required, and that's not a good thing, right? Hardly a laughing matter, or scary as heck, actually. But that said, highly unlikely. And the best way to increase bone density, and we'll repeat this again here shortly, is compressive force activity, which means walking, jumping, running, something that loads your spine and your legs. And if you want to talk about improving bone density of your upper body, we're talking about pushing type exercises that load the arms, chest presses, overhead presses, the exercises like that. Anything that actually we can handle the impact of from a standpoint of movement skill wise, then we can actually entertain the idea of it helping our bone density and therefore reducing problems such as this. Overall volume of training, kids can handle the same thing adults can, just like adults, same as with kids. It has to be reasonable in the sense that if performance is waning, they can't handle that volume. If they're getting worse from set to set, they can't handle that volume. And then, as we've said a million times before, and it makes sense to keep saying a million times until everyone starts following suit in the coaching field, athletic performance field, in any field of fitness and exercise, that if your performance is going down, it's time to consider cooling down or quitting for the day, coming back either later today, if you so choose to do so and can handle such stress, or come back another day. You don't keep going with just because it's something you have to do because a book said so. You need 6 sets, not 4 or 2 or 1. If you can't handle that level, don't pursue it. Take some time off, come back and slowly build up to the point where you can actually handle such stress. Can children lift weights? Yes, they can. Can they handle the forces? Can they move well? Then yes, they can handle that load. If they can't, they shouldn't lift that load. It's really pretty simple, okay? Women, as far as the triad goes, bone mineral loss, we've talked about this before, increased bone density. Yes, they have to take in any supplementation from calcium and minerals they need to help support bone density and not loss or bone loss, bone mineral loss. But if they don't engage in compressive force activities, it doesn't matter. You're going to gain back maybe a little bit of what you lost, but not a lot, and you cannot improve bone density from whatever you were in the past unless you engage regular activity that engages compressive force activity. Low energy availability, of course, the predominant need of most people. Water is the obvious one, more of an important macronutrient than any other macronutrient. Got to get enough water or it can dramatically affect performance quickly and very negatively. However, from a nutrient standpoint of food, carbohydrate is the biggest one. If someone's having energy deficit issues, carbohydrate is almost always the culprit. It happens so often. You talk to someone, next thing you know, they're doing a keto diet or they're doing some low carb thing. That's why you're, quote, bonking or you're feeling nauseous. That's a common sign. Nausea during exercise, it's more glycolytic or higher intensity in nature or a super long duration where they burnt through what little carbohydrate they have. Whatever super long duration is, long for them is what we're referring to here, then it's carb they need. Menstrual dysfunction in general, amenorrhea or disrupting the menstrual cycle for any number of reasons that we can't always tell what the reason is, or dysmenorrhea, painful menstruation. To avoid such issues, really simply, as we've said so many times before, whether you're talking about anyone, let alone someone who's at risk for such things, we want to make sure we're monitoring RPE, heart rate after every single set, right? And of course, looking at form, watching facial expressions, and engaging whether or not this is too high of an intensity. And during someone's formative years, especially for women, when they're younger teen, and really at any time in their life after that, we have to be more conscious of it because there's more of a potential functional issue for their hormone sensitivity as it relates to their menstruation cycle up till their, whatever it might be, 40s or beyond. It's very important to take that into account and use those same factors and pay close attention to them to make sure we're not over stressing the woman in this case. That said, Q angle, we've said this before, the relationship with the hip to the knee going downward. Women typically, almost always, are going to have more of an issue with this than men are, especially if they had more kids as it relates to childbirth, right, and the pelvic girdle width. That said, when that is an issue, it becomes more important, tantamount in fact, to have proper strength training where the hip, the knee, and the ankle are in alignment. Proper split stance squats. People often refer to them as stationary lunges, but split stance squats, one-legged type squats if they have such balance capabilities and strength capabilities. But anything that probably loads more unilateral than bilateral, because we want to make sure we're stressing properly each side rather than have the dominant side overperform the weaker side. Even though that's biomechanics, honestly, more so than physiology, so to speak, there's correlation or crossover here, and it's important to note these factors, okay? And of course, that specific joint action has to be reinforced, the proper hip, knee, and ankle action over time with movement skill, not just loading. Asthma, if you're asthmatic and you want to improve your asthmatic condition, beyond the obvious of prescription drugs under the care of a doctor as needed, or anything the doctor recommends that you do, which always supersedes anything we do as a coach or in athletic circles. But cardiovascular exercise improves anyone's problems if performed at the right level on a given day, right? Let alone the right duration, can absolutely improve someone's condition. And like all things, whether you're asthmatic or not, if you're not feeling good, well, you have to decide if maybe a light day is a good idea today, a light walk or some light jog or something that engages about that level of activity, or maybe it's a day to not work out if you're concerned about such things at all. Otherwise, 30 to 40% VO2 max, which is about 65% of your max heart rate, is a pretty basic low-level stuff for anybody. And of course, everyone's level is a little different for actual speed at such levels of effort. But that said, almost anybody should be able to handle that unless they've got having a major attack asthmatically or some other health-related issue. And of course, we're looking at mostly steady-state type stuff. But there's nothing wrong with doing aerobic type intervals here that are technically below or well below your lactate threshold for anyone who's looking for recovery, reduction of cortisol, and improvement upon basic levels of health. Okay. Any athlete, though, with any special needs, as we just said, need to be having a greater focus on RPE and heart rate, not just what the force output is and how well they move, but all those things need to be taken into account. And the more factors you can observe going on here from this class and onward to whatever else you do with coaching and athletic performance Let's make sure we're looking at all these factors. Don't take any of them for granted, because the sum total of all of them are what give you the feedback you need to make the proper determination of what you should do in a given moment to help your athlete improve or just get better for the day. And that said, basic nutritional needs, we're looking at about roughly 45 to 65% of your diet coming from carbohydrate. Athletic circles often refer to 55%, and that's perfectly fair in most situations, but definitely not going below 45%. I've never known in any research supportive study for any level of athletes, especially endurance type athletes, to be able to handle significant levels of force production over long periods, over long seasons, let alone year round, with diets that are less than 45% of carbohydrate. Are there going to be special circumstances where that might be the case? Sure, but unless that athlete's already performing better than every other athlete, if they're going down low in carbohydrate, as a coach, I'd be concerned about that being an issue for them. And of course, whenever you're engaging something like diet and the intricacies of the challenges with diet, if you think that's going to be a particular issue for your athlete, whether they are younger or older, younger obviously consulting with their parents under 18, but when they're 18 years of age or older, definitely have a dietitian or a clinical nutritionist, someone who actually has a degree in the area, not just a basic certification like I have. Mine's just a certification, which is fine. It's level above others, but not the same as what we're looking for here for a specialist to come in and talk about the needs that we have for each level of nutrient, generally speaking, to perform as a whole better. And of course, 20-35% of your diet from fat, more towards hormonal production of the sex hormones and hormonal balance, and more energy needs, fiber, brain function, little metabolic function for carbohydrate, and protein more toward the cellular growth and repair of every cell in your body for 10-35% of your diet from protein. Okay. And then that said, in our important concepts from this week, altitude training. Yeah, your book will refer to, there's some controversy about whether or not live high, train low is the most ideal, but it certainly points, most of the research points to it. You living above 6,000 feet, you training low on your higher intensity days. Now, the reason why some of the research is lacking here is that it's hard to have efficient controls with this. You're having athletes with different levels of VO2 max going up to train at altitude, who are training at different levels of different performance intensities at altitude or at lower sea level. It's really hard to correlate adequate data to know for sure exactly the amount, how often you should train one or the other, all those things. But the most significant data seems to point to the idea you got to live above 6,000 feet, got to stay up there as much as you can during that time. And then when you're ready to train at more higher intensities, anything that's intended to be more glycolytic or anaerobic power related, you're probably glycolytic related, we should really say, or VO2 max related, where you're trying to improve VO2 max, you're better off training low near sea level. Speed work may not be affected much by it. Okay, we're not overly worried about that. But anything that's related to your aerobic capacity and your lactate threshold type work for longer duration type work, critical power, all that kind of stuff, might be better off focusing on down training low for such things. Recognizing that if your goal is to improve actual performance parameters for a sport to do so, you got to live there at least 21 days doing this kind of live high, train low. And when you return back to sea level to be back at sea level long term now again, you're going to start losing your benefits pretty quickly within days. Unless you've been living your entire life at high altitude, then you could probably see less of a challenge with loss of that same performance benefit with the hemoglobin-rich blood, helping your red blood cell count, helping your oxidative capacity to be able to handle stress for longer periods of time. Okay. Extreme heat versus extreme cold, we talked about in the past. When it gets to be too hot for an individual, they're going to be at risk for health issues, let alone performance. Speed athletes, power athletes, less so. Endurance athletes, glycolytic type performances, absolutely. Obviously, the greater need to hydrate. You're still not looking at carbohydrate drinks unless we're engaging in activity for an hour or more. Okay, regardless, just need more water if they're engaging in performances in high heat for less than an hour, glycolytic level and or endurance related levels. Okay. That said, when they start to experience disorientation, sweating profusely, and they're looking a little bit pale, the risk for here is heat exhaustion, and you got to get them, they're done with activity, cool them down as fast as possible, drinking plenty of fluids, and get them cooled down. Heat stroke is much more serious, and now we're talking about a loss of sweat. This should never happen in sport, because it means heat exhaustion's already occurred. They move past that. Now they're in heat stroke. They may be fainting. They may actually faint or pass out. And we've all heard stories about coaches having athletes pass out, get back up, and keep going. Okay, that makes absolutely no logical sense if you care about people, if we can be blunt here. That said, what we're really talking about is heat stroke, whereby it's a 911 call. Anytime someone ever loses consciousness, it's 911. They're at extreme risk for something to happen from heat stroke. If they're beyond a little disoriented, they're barely able to walk at all. They're all over the place and not sweating anymore, very hot, getting reddish at the skin. That's cold immersion, even better, ice immersion bath or cold immersion bath, and a 911 call, okay? Very scary stuff. Cold environments can dramatically reduce body temperatures if engaged for long periods of time in cold environment. And like heat, we try to avoid it if we can by training at proper times of day where it's hotter if it's more normalized temperatures, out of the early mornings for extremely cold, right? More toward later in the day. Quite the opposite with heat earlier in the day, right? And of course, either way, we're looking at short warm-ups, 3 to 5 minutes for those extreme situations for heat, and for cold, the other way around, a longer duration warm-up, okay, to make sure they get plenty warm for their activity that's going to follow. And air pollution issues, generally speaking, if the air quality index is more than 50, it's concerning. We need to take a closer look at what we want to be doing today, if it's going to be a good idea to engage in some higher intensity activities. If it's above 100, even more concerning. Why would you even want to go high intensity? Above 150, probably shouldn't be exercising at all with our athletes if we have such choices. Earlier in the day will help. Obviously, windy, light, cool breezes are going to be helpful to you as well. And working out in high urban areas, those are not always choices that we have. But trying to reduce those air quality problems is something that's very important for us to do if we have the capacity or a capability to do so. And that said, supplementation versus the diet. There's a lot of things we can do. Diet should be strong first. We already talked about carb, protein, fat, and water, how important they are. To be really clear, vitamin mineral supplement, I'm going to go counter to what a lot of books say, including our textbook, that a lot often say you should get what you need from diet. Should. When you really look at research, we start taking athletes or people who are pursuing high levels of stress, any kind of stress, and we actually take them, not the normal population, people who engage in high levels of stress. Then we take their blood and we look at their level of nutrient needs, and you're going to find their nutrient need levels are much higher and in many cases need a supplementation. The first thing I recommend for most people is a vitamin mineral supplementation. And yes, you're going to urinate out those vitamins, basically the water soluble, that not every vitamin you take in, you don't pee out. That's not true. It's the B's and the C's. And only if you take in too much. And well, how do you know what to take? Unless you take a blood test before you take a pill, you won't know. And the high toxicity level for vitamin C, vitamin B, E, A, any of those is so high. You'd have to grossly overtake vitamins and minerals for months and years to see such problems and challenges. And like all things, that's something they have to take a look at each individual, but I've never known any athlete who can be benefited by a sum total of vitamin mineral supplementation, because the problem is people try to take them in isolation, thinking that a little vitamin C supplementation or a little bit of vitamin E or vitamin B supplementation is going to play a great role. Vitamins work in synthesis. If you don't take them in the right amounts together, you're not going to gain the benefits from them. You're kind of wasting your money in that regard, so be careful with that. But assuming a person has a good diet, they're getting what they need, generally speaking, and they want to have a higher level of performance, then we talk about things like creatine monohydrate. And I don't want to hear when you actually start saying, I don't believe in supplements. That's just, to me, a gross, negligent response to not performing sufficient research on the possibilities of these supplements. Like all things, any given individual doesn't necessarily need supplementation. But to say grossly, I don't believe in supplements, or we shouldn't need supplements, okay, you don't think that they should be taken because you're concerned about giving someone a performance edge, that's a decision you have to make. But there are definitely the IOC, International Olympic Committee, and all sorts of unifying bodies for different levels of sport, NCAA for collegiate sports. They all have their levels, and they'll talk about levels. They won't say you shouldn't take this nutrient. They'll say if your nutrient levels or your intake levels intend to be found to be above a certain level, then you are what's determined to be unfair in your practices. So it's not so much what you're taking, it's how much you take of it. And that's something we have to think about, toxicity levels, right? And there's a reason for it. Health is a primary concern, not just performance. Creatine monohydrate can absolutely help with glycolytic performance. Your book refers to it sounding as it's closer to 30-second to 60-second range where it helps most, which is hypertrophy, high intensity interval type training, glycolytic type work. Okay, that's where you're going to see the highest performance gains from taking something like creatine to 2 to 5 grams per day. It's not necessary to load it. I wouldn't take it unless you're already ingesting a significant amount of water. And while taking it, you're probably going to have to increase your water intake by 16 to 32 ounces or more on a given day when you're taking such supplementation, because it can dehydrate you, because creatine monohydrate causes the water to be basically sucked in and stored in the muscles more efficiently, which is great, but it's not going to give you systemically the water you need if you're not taking in added water. So a lot of the concerns people have about creatine are unfounded if you're ingesting enough water. But yes, you're going to gain mass, and that may not be the goal. If the goal is not to gain mass, creatine monohydrate may not be a good supplement to even consider be taken. That said, aerobic performance and blood doping, we're talking about basically taking blood and then putting it back in your body, taking your own blood out and putting it back in, or getting someone else's blood and putting it into you with enriched hemoglobin levels within the blood, basically higher red blood cell count, higher capacity to oxidize and utilize oxygen. So consequently, we're talking about performance improvement for endurance-related activities of anywhere between 34% on the high end, like really high end, for like performances that are 10, 12 minutes in length, somewhere in there, like VO2 max. And as you pursue more toward your critical power rate and your lactate threshold, they'll see performance levels be improved by like 3% up to like that 34%. So it can see 3% though, world-class level, that means a tremendous amount. If I had been able to improve my performance 3% and basically as a 100-meter runner, I would have been in the Olympics, and it would have been no question about it. 3% is dramatic. Okay, as opposed to falling off and not making the anywhere near the Olympic trials. That's a big difference. And a lot of sports, that's the difference between being near the back of the pack and winning the whole thing. So that's a big deal. That's why blood doping is highly regulated now and a big concern. And they can hide it. There's a lot of things that people can do, like taking it during certain times of training and then try to wean off of it so you don't show the effects as you get in your performance. But it's a difficult thing to track too. Blood buffers like sodium bicarbonate and other phosphates you can take in can help tremendously in reducing the time, or increasing the time it takes to reach that lactate threshold, to increasing the time it takes to develop significant excess hydrogen ions, so you can perform at higher intensity type work for longer periods, especially as it refers to work that's engaging about somewhere around a minute to about 10 minutes, where glycolysis is still playing a role for the beginnings of the early stages of glycolytic involvement to where it's weaning off completely and going absolutely almost 100% toward aerobic type level work. That said, it can also cause gastric distress and gastrointestinal related problems. But again, water becomes a significant amount of intake to a much higher level beyond what you normally would take. And yeah, you got to be really careful with this stuff. It's not illegal or wrong, and you can really improve performance. And I've seen it, and I've seen it done, and actually performed higher levels of performance glycolytically for 800-meter runners, 400-meter runners, and milers and whatnot. However, like all things, got to take it in the whole context of everything that's going on with the level of intake and other nutrients and how it's going to affect performance, possibly negatively if not performed properly, and may not be necessary as a whole because of the concerns. Caffeine certainly can help improve performance, and that's more towards endurance performance. So really you're looking about like steroids improving like anaerobic power type work and some of the maximal strength type gains, and it can improve even performance for longer duration than that, but that's where it helps the most. But of course, steroids, we're basically talking about illegal substances with any even mild level found in your blood. But yeah, the reason is because they can reduce inflammation, they can decrease recovery time and get you back in the gym and back on the track, back in the pool and going again much sooner than everybody else. So you can put in a lot higher volume of work than everybody else, gain more strength, gain more endurance. And that's the reason why steroids are high on the list of no-nos, so to speak, in performance, okay? But caffeine can help significantly with endurance performance, and they've shown to improve performance up to like 30% in some instances for cyclists and for runners. It's pretty impressive stuff. But it also talks about taking as much as 5 to 10 grams per kilogram of body weight. That's a lot of caffeine. I weigh 100 kilograms. That's me taking in 500 to 1,000 milligrams of caffeine. I can tell you right now, unless you've been doing this for a long period of time and gradually increasing your caffeine intake, you're just going to end up with negative response and serious health issues trying to take that much caffeine in. What's much more reasonable is about 200 to 400 milligrams of caffeine, which is nowhere near what the book was talking about, because it's not really going to probably perform at the 30% performance improvement level, but it's also going to be much more reasonable and much less risk to an athlete. And yes, you got to do much more research on these before you make determinations of good, bad, good idea, not a good idea, fair, not fair, illegal, legal. There's a lot of things to be looking at before making these choices, but don't make this grand gesture of it's all not good or all of it's just fine. That's just not true. Okay? That said, final thoughts. For those of you in the course, you're almost there. We're finishing out our course here. I wish you the best with everything you do going forward. Call or email if you have any questions regarding anything when it comes to performance. This is so much information. It's hard to extrapolate all of it and make use of it, but it's an ongoing thing. I would expect nothing less than you for the betterment of your own athletes, let alone the betterment of you as a coach. I wish you all very well. Please let me know how I can help, and the best of everything to you in the future.